Hi, my name is Tressa Burton. I am part of the RN to BSN program here at WVUP. Today I'm bringing to you our Unit 4 discussion, which is on healthcare disparities. So I did some research. I went to the KFF.org website and I looked. Was a brief that was done with Naga and Artiga, and it was disparities in health and healthcare, five key question and answers. Within this, I got some kind of background of what healthcare disparities are. The information that I received, a healthcare disparity typically refers to differences between groups in healthcare coverage, access and use of care, and quality of care. Terms health and quality, inequality, are also used to refer to disparities. So with this, health and healthcare disparities, they're not new. They have been documented for decades, reflecting long-lasting structural and systemic inequalities rooted in racism and discrimination. So focus in the healthcare world needs to be narrowing health disparities. It is key to improving our nation's health, overall health, and reducing unnecessary healthcare costs. So with that, further looking into the health disparities, I went on to the Office of Minority Health and looked through their publications of what health disparities they have researched. And I found one that was very interesting. It was from Buell, Wint, and Backus. The title of this journal entry was Understanding and Addressing Health Disparities and Health Needs of Justice-Involved Populations. So these are the people that are within our federal prison system. They're incarcerated persons. So the rate of incarceration in the United States is among the highest in the world. So right there is just a big shock. So we, as the people in healthcare, that's a responsible group that we need to take care of. Numerous health disparities exist between persons involved in the justice system and the general U.S. population. But interesting enough, within this research, persons in state or federal prisons are 1.5 times more likely than persons in general U.S. population to report ever having a chronic condition, and half of all persons in state or federal prisons report having a chronic condition such as asthma, heart disease, or diabetes. So they are, more than half of the incarcerated population had mental health problems. We are looking at a vast majority of people being a very high population of health needs. So with all of these health disparities, I mean, you equal in the racial and ethnic minority groups that are out in public, but they're also involved in the injustice population as well. So when you look at all of these, the Office of Minority Health, or the OMH, has initiated programs, policy efforts, and data initiatives to address health needs and partners with other federal agencies to help address the issues of the injustice or the justice involved population and with their families. So in October of 2016, there was a program that was launched. It's called Reentry Community Link, or Relink program. It was involved to focus on 18 to 26-year-old adults released from jail. So addressing the health at reentry is so important for this population because another very interesting fact through this research is more than 95% of incarcerated persons will return to their communities. So people that are, incarcerated and are sick or have infectious diseases or things that need to be treated, they're coming back out into the society. They're coming back out into their community, and they need to have their further treatment. So things need to be set up with them. So something the Office of Minority and Health is definitely addressing. They've got lots of, like I said, programs, policies, things that are in the works that are working with many other agencies to address all the concerns that are needed to make it efficient for the justice involved population to be, addressed appropriately and taken care of. So thank you very much. That's my report on health disparities. Have a good day.